presentation due during childhood. By definition, we say that an spontaneous hematoma is because an absence of any identifiable cause, like it can have any traumatic origin, or arteriovenous malformation, or bleeding diathesis, or minor trauma, and it can't also be due to a lumbar puncture. It may affect every age, but it's rarest in children and even more in infants. The estimated incidence is of 0.1% and is less than 1% in all patients. It was the distribution of the incidence of this rare disease. And here you can see that in children is even more less frequent. The literature about this disease is restricted only to case reports and case series. Here are the cases reported since 1967, and all of these reports are only case series and case reports, making it a rare disease. The symptoms about spontaneous epidural hematoma are not specific on infants. The majority of the cases presents with irritability and neck pain, with the neurological deficits being minimal and often no recognized until it's declining. The differential diagnosis is hard because this disease is very rare. The most frequent differential diagnosis is Guillain-Barré syndrome, but it can be any of these: Guillain-Barré syndrome, a vascular malformation, an extradural arterial fistula, an infectious disease. Lumbar puncture and cerebrospinal fluid results are non-specific for hematoma and no longer are recommended. The pathogenesis of this rare disease remains unclear. Most series consider a venous bleeding as the origin of the hematoma due to a rupture of a lucus minori resistency in the epidural valvulus venous plexus, making the epidural space vulnerable to any extreme change in pressure. The diagnosis can be made with MRI. This is the modality imaging of choice to diagnose spontaneous spinal epidural hematoma. Being able to infer the extent, the age of the hematoma, and the location on the spines. And also, it can show to us the compression effects of the hematoma to the medulla. The T1 image helps in the follow-up evaluation of the patient, while the T2 image is crucial in the differentiation between an hematoma and a tumor. If you see a vascular enlargement on the MRI, you need to do a spinal angiography prior to any surgical intervention. The most frequent spinal level affector are the cervicothoracic spine. Only a few cases have been reported at the lumbar spine. The treatment is a really neurosurgical emergency. It's a critical and surgical emergency. You need to perform a spine decompression as a treatment of choice. You have to do it to prevent any neurological deficit and any associated morbidity. Treatment delay from clinical presentation to treatment has been reported to be from 2.6 days and 13.8 days, with a median of 5 days. See this. This is very important because it's a rare disease with a lot of of differential bad diagnosis. So by the time the patients enter the emergency department to the time that the patient received the surgical treatment, it had been reported a delay from, let's say, 5 days until the definitive treatment. So let's talk about our case. This one, a 14 months old male patient with a 10-hour history of neck pain and irritability associated with lower limbs weakness and fever. The initial diagnosis made by our pediatrician was a central nervous system infection. So they performed a lumbar puncture and start antibiotics. But after 14 hours without neurological improvement, they start to think about a Guillain-Barré syndrome. So a methylprednisolone pulse was additioned to the treatment without any neurological improvement. 4 days after the neurological symptom presentation, a neurosurgery consult was performed to rule out a spinal compression syndrome. These are the initially the first MRI performed at our pediatrician emergency department. And here you can see a cervicothoracic epidural hematoma. This is the sagittal view, and this is the axial view. In the axial view, you can see the epidural hematoma with the compression of the medulla. So we perform spinal angiography, ruling out any vascular malformation. The patient was go to the surgery department. We performed an extended laminectomy, and 3 months after it, the patient had a complete neurological improvement. Here you have the 3 months postoperative MRI showing a complete resolution of the hematoma with a complete expansion of the medulla. And here you also have the 3 months spinal angiography without any vascular malformation. So a complete neurological improvement was achieved in this patient. And as conclusion, I want to say that spontaneous spinal epidural hematomas are a rare condition on pediatric patients due to a high risk of neurological impairment. It must be expected in any infant with irritability, weakness, and neurological deficits of unknown origin. A prompt diagnosis with MRI and surgical evacuation had to be done on time to ensure a good prognosis and improve the neurological outcome. This is all what I have to share with you this morning. So thank you very much. And greetings from Colombia. Thank you. Any question?